Patients who have got reflux symptoms, that is, patients who get acid reflux onto the back of their throat, especially after they go to bed at night, and also who have got volume reflux, that is, you've got stomach contents coming up to the mouth, especially when patients bend over or associated with their usual daily activities, then these patients usually have got a hiatus hernia. So what I want to impress here is that all patients who have got hiatus hernias do not have reflux. Hiatus hernias are important when they contribute to the reflux symptoms. Those patients should then undergo evaluation with 3 tests. One is a camera examination called upper GI endoscopy. And the one is a dye test called a barium swallow. And another test is the test to measure the acidity and the pressures of the esophagus called 24-hour pH and manometry. Once the patient undergoes all these 3 tests, it gives us information to decide whether the particular patient will benefit from surgery for the hiatus hernia. So it is important to understand that all patients with a hiatus hernia do not necessarily need surgery, but those patients with hiatus hernia and significant reflux symptoms who are not symptom controlled by anti-acid medications, those patients then need to consider surgery with a view to control their symptoms. Yes, so by and large, the side effects are temporary. The most important one being immediately after the operation, the patient may have difficulty in swallowing solid food. So patients after this operation are advised to have liquid diet for 2 weeks, then gradually stepping up to soft diet for the next 2 weeks. And by 4 weeks, they should be able to tolerate solid foods. So at the end of 6 weeks, however, this symptom of temporary difficulty in swallowing should settle. The other important symptom is that they will have bloating after they eat something. That is because they will find it difficult to belch after food intake. And so they'll have buildup of gas inside the abdomen, which then they'll have to pass it downstream via increased flatulence. But these symptoms are temporary and they should settle down within a few months after the operation. The important thing is that the patients get relief from the reflux symptoms and are usually off their anti-acid medications after the operation. And this is important because recent evidence have suggested that lifelong intake of medications such as PPIs are associated with significant side effects and even increased incidence of stomach cancer. Absolutely. Most of my patients, they get instant symptom relief the very next day. And they're able to go about doing their daily activities. They can eat almost every type of food. The important thing is that after this operation, the patient should not be having protracted common cold symptoms involving coughing or protracted vomiting after getting a stomach bug. So they should seek urgent medical help and take symptom relief. Otherwise, the hernia repair can give way and can cause reoccurrence of symptoms. So essentially, after the operation, you'll be able to lead almost a normal life. Um, and the important thing is you'll be off the medications. Having said this, I would say for patients with reflux symptoms, the first line of treatment is always medical. You've got to try to see whether the anti-acid medication help. And if it helps, usually it settles down within 2 months' time. If after stopping the medication, the symptoms come back, then I would suggest that you will have to undergo the 3 tests to see whether surgery helps. I must tell you that surgery doesn't help in every patient. For example, based on the tests, if the patient is found not to have the classical features of gastroesophageal reflux, which is reflux of contents from the stomach to the food pipe, but they have got features of intraesophageal reflux, which means you've got a hold up in the food pipe because the food pipe is not contracting properly. Then in this group of patients, surgery will actually do more harm than good. So it is important that the patients have all these tests done properly to decide whether surgery helps.